Yes, this is Camille Robinson. She will give a talk about the assessment of patients' perception and opinions about the dermatologist when they were first diagnosed. Please.
Hi, my name is Camille Robinson. I'm a third-year medical student at Duke University School of Medicine. And the title of this presentation is called The Assessment of Vitiligo Patients' Perceptions and Opinions about their Dermatologists when they were first diagnosed. For some background, between my co-authors and I, combined we have years of experience working with vitiligo support groups. And there seems to have been a common trend. That is that patients with vitiligo express negative opinions about their first dermatology visits. And although there's been a lot of research that has been published in regards to quality of life outcomes, there's little that is known regarding the perceptions and opinions patients within this community have about their dermatologists. The purpose of this study was to identify and analyze the experiences patients with vitiligo encountered when they were first diagnosed, and also to provide guidance to dermatologists about the needs of this community. A survey was developed to capture key aspects of the patient experience, which included overall experience and the personal skills of the provider, explanation of diagnosis and treatment, as well as satisfaction. Now, this is an ongoing study, and thus far we have 31 participants, 26 identified as female, and 5 identified as male. The large majority of our participants are between the ages of 55 and 65. A large majority also identifying as Black or African American, and the overwhelming majority identifying as non-Hispanic or Latino. In regards to age at diagnosis, a large percentage of our participants were diagnosed at the age of 18 or younger. And with type of vitiligo, a large majority of our patients identified as having non-segmental vitiligo. As you can see here on the screen, I've extracted 4 survey questions that I feel truly capture the patient experience. And all of these questions address reassurance and support offered by dermatologists, attention given to what you had to say, concerns and fears regarding the diagnosis, and clarity of explanations. So we used the Likert scale, as you can see here, and then the percentages were grouped together. Less than satisfied encompassed extremely or somewhat dissatisfied, and satisfied encompassed extremely or somewhat satisfied. And if you take a look here at the table, a large majority of our participants were less than satisfied in all categories, specifically with the fears and concerns category at 55.2%. We also wanted to capture treatment options, and as you can see, a large majority of treatment options were provided, but nearly 10% of our participants had no treatment offered to them. And 44.8% of participants stated that dermatologists did not mention camouflage options. We also wanted to see if insurance was a barrier. So when asked if treatment was covered, 25% of participants stated no. And in regards to affordability, 32.1% stated treatment options that weren't covered by insurance were not affordable. We also had a free text option for our participants in the survey. And as you can see here with question 26, what recommendations do you have for your dermatologist based off your experience? We have direct quotes taken from our participants. Take time to explain the disease and schedule an additional meeting to answer patient questions. Recommend support groups to get different perspectives and to not be alone. Be patient with us. It takes a while to absorb the diagnosis. Understand how the patient is feeling, and when you deliver the diagnosis, be ready to answer questions or at least point them in the direction of someone or an organization that can help. So our study has a number of limitations, mainly recall bias, as we are asking our participants to answer questions based off an experience that happened years ago. We also exclusively recruited support group members, which may not reflect the entire vitiligo population. We have a small sample size, although our study is ongoing, and most of our participants were diagnosed at a time where vitiligo awareness was not as great, and the information that we have now was not readily available. So in conclusion, participants and patients are less than satisfied with their first dermatology visits when they were diagnosed with vitiligo. And overall, we think that it's extremely important for dermatologists to explain the history of vitiligo, as well as the natural course of spreading in discussion. We also think it's vital that dermatologists address concerns and fears of patients and also answer questions in a compassionate and empathetic way. And we also think that recommending support groups to those who would benefit would be an extremely important thing to do. So I'd like to really thank my co-author, as well as my principal investigator, as well as the Vitiligo support group leadership and the Vitiligo members who partake in our study. Thank you so much for your time.
Thank you very much. This was a very interesting talk. I was curious about, I think it's really important to have these data and that there is work needs to be done. I think it's clear. And do you have also suggestions? How could we improve this?
Yeah, thank you so much for having me. And I think that's a really important question to ask. I think the main thing that I would recommend is just before every patient encounter, especially with a patient who is coming in with concern for vitiligo, to really take a step back and try to understand where the patient is coming from, be open to what they have to say, definitely addressing their fears and concerns and paying attention to what they're just scared about, the things that they need moving forward as a patient who's going to be living with this for a very long time until we get something that can help. So I think that is like the main thing that I would recommend for dermatologists and other healthcare providers, is to really just listen to your vitiligo patients and try your very best to address any, issues or concerns that they have.
Yes. Okay. Thank you. Do you because if we look to the feasibility of doing this in a very busy daily practice, I can imagine it's not so easy. Maybe in this context, would you recommend to refer patients to a specialized center to have more information that they deserve? Is that an option?
Yeah, I definitely think that's an option. And I understand your point. In a busy practice, it's really hard to spend a long time with patients and really kind of unpack their feelings and emotions about a particular diagnosis. So I definitely acknowledge that and know that it's a barrier for providers. But I think as one of our participants said, being able to have an organization or a support group or some entity that you can refer your patient to so that they can get more information and also just feel more comfortable, have an open space to talk about what they're going through, I think is going to be extremely key.
Mm-hmm. Okay, thank you. Just a quick look. I think we received a question. Did you collect, I'm not sure this is referring to your presentation. Did you collect data with regard to the ethnicity, of the dermatologists who they saw? I think this is a good question. Yes.
Yes. Oh, sorry.
Did you collect data regarding this?
Yes, we did collect data in regards to the race and ethnicity of the provider. But given the kind of time constraints of the presentation, I didn't want to delve too much into the provider aspect of it. But yes, we definitely did collect that data. And hopefully as we get more participants and publish this, you guys will be able to see that as well, the correlation.
Okay, looking forward. Thank you. Any more questions? No.
It's only about it's only about the dermatologist specialty. I mean, it is just a general dermatologist or a dermatologist with interest in vitiligo. Did you have this question? I think it would for sure make a difference.
Yes, thank you for your question. So we just asked specifically about a dermatologist. We didn't specify dermatologists who particularly had interest in vitiligo, just because we know that a lot of patients may not have access to dermatologists who may specialize in that field. So we didn't want to limit them from participating in the study or being able to collect that data.
Yes. All right. Thank you.
Thank you very much. I think